Bob Saget was found dead in his hotel room on January 9th, the morning after the 65-year-old had performed a stand-up comedy set in Orlando, Florida. An autopsy report says the Full House actor died as a result of blunt head trauma, likely caused by an accidental fall. Saget did not have illegal drugs or alcohol in his system, but he did have a fracture at the base of his skull and around his eye sockets, bleeding between the brain and the tissue covering the brain, as well as bruising to the brain.
If you have a full brain and it occupies the entirety of your skull and you have a head injury, the swelling of the brain there's not much room for the brain to swell. And because the brain is a very delicate structure, if it does swell, it can cause the end result of someone basically dying.
Dr. Carl Larayson, a neurosurgeon at St. David's Round Rock Medical Center, says it's important to err on the side of caution and seek medical attention anytime you suffer a blow to the head, especially if you're on blood thinners, and that includes aspirin.
You can have a head injury and you may think that you're fine, but unless you get evaluated, you as a patient wouldn't know if there's any underlying red flags or danger.
Dr. Larayson warns people not to ignore symptoms such as headache, blurry vision, or trouble with balance after hitting your head. A CAT scan of the brain can tell if there is a critical bleed that needs to be stopped.
As neurosurgeons, we have the ability to get patients into the operating room really quickly and potentially save their lives. But in the same way, if there is any delay in diagnosis or delay in treatment, the consequences can be extreme and even fatal.